How can community-based research inform cultural adaptation? How can community-based research inform cultural adaptation? This question is vital for understanding how we can better manage chronic diseases within diverse communities. Community-based research, often referred to as CBR, actively involves community members in the research process. This involvement ensures that cultural values and social contexts are accurately understood and integrated into health interventions. Cultural adaptation is about how cultural practices and beliefs change in response to challenges like chronic disease management. CBR provides specific knowledge about how cultural factors influence health behaviors and perceptions within a community. This knowledge helps identify which parts of a health intervention need to be modified to align with local norms and values. The process starts with gathering information. Researchers work alongside community members to identify cultural differences in health-related risk factors. This phase is essential to determine if an adaptation is necessary and which components should be adjusted. For instance, understanding how a community views chronic illness can guide the adaptation of health education materials. Using culturally meaningful symbols can make these materials more relatable. CBR also includes feedback loops. Preliminary adaptations are tested within the community, and feedback is used to refine the intervention. This ensures that adaptations are not only theoretically sound but also practical and culturally relevant. Community advisory panels often play a crucial role in providing insights that researchers might overlook. Additionally, CBR addresses the dynamic nature of culture. This includes processes like acculturation, where individuals navigate between their native cultural practices and those of a new environment. Understanding how acculturative stress impacts health behaviors allows for better support through culturally adapted interventions. For example, strategies that strengthen familial and social supports can be integrated. In the context of chronic disease, CBR reveals how social networks and cultural practices influence disease management. Research shows that cultural adaptation involves balancing individual innovation with group-level cultural knowledge. By engaging communities directly, researchers can identify pathways that support both cultural continuity and necessary change. Practically, community-based research informs cultural adaptation by identifying culturally specific health beliefs that affect disease management. It highlights social and familial structures that support or hinder health behaviors. CBR also facilitates culturally appropriate communication strategies and ensures interventions respect cultural identities. This approach enhances community ownership and sustainability of health programs. By integrating community knowledge and participation, CBR ensures that cultural adaptations are ethically grounded and contextually relevant. This makes them more likely to be effective in improving health outcomes within diverse populations. Understanding culture as lived experience and social practice is essential in health and medical anthropology.